Hey, I'm Neurosurgeon Kazu.
We all know the feeling. You sit cross-legged for too long and your foot goes numb, or you stand up too fast and the room spins for a second. We naturally brush these off as temporary glitches. It makes perfect sense to sit and wait for a dead leg to wake up. But when that exact same instinct is applied to a glitch originating inside your brain, waiting to see what happens becomes a fatal error. A stroke operates on a merciless timeline. Every minute you spend dismissing the brain's subtle physical SOS signals, millions of irreplaceable neurons suffocate. In neurosurgery, we see a consistent, tragic pattern. There are 5 specific warning signs of a stroke that our own common sense actively tells us to misinterpret. Our most logical, everyday reactions to feeling unwell, like lying down for a nap, having a glass of water, or just taking it easy, are the exact actions that make these 5 warnings so deadly. Survival begins when a patient recognizes their own intuitive responses and then deliberately overrides them. The first trap starts with the room violently spinning. When sudden dizziness is paired with double vision or trouble swallowing, people often assume they just have a nasty case of vertigo or an inner ear bug. But look at the brain's architecture. That specific combination of symptoms points to a severe restriction of blood flow in the brainstem or cerebellum, located at the base of your skull. The second trap is assuming that sudden weakness or numbness is simply a limb falling asleep from bad posture. If numbness happens instantly and affects strictly one side, say only the right arm and leg, the brain's motor control network is failing. Because wiring crosses over to control the opposite side, a unilateral strength drop is a red flag. These bizarre physical malfunctions are not localized issues in your arm or inner ear. They are direct maps revealing exactly which part of the brain's vascular network is currently suffocating. The third trap happens when half of your visual field goes dark, or a black curtain seemingly drops over one eye. The immediate instinct is to blame eye strain or fatigue, but vision loss like this is an active neurological failure, a severe blockage in the thick internal carotid artery or in the occipital lobe at the back of the head is physically starving the optic nerve of blood. The fourth trap involves communication. If someone suddenly slurs their speech or can't find basic words, it is easy to write it off as severe brain fog or exhaustion. This is actually a mechanical breakdown of the brain's language centers. Whether it is dysarthria, where the mouth muscles are paralyzed, or aphasia, where the brain itself loses the ability to process language, the hardware is breaking down. These highly specific, localized failures mark a targeted emergency unfolding in real time. The most dangerous psychological trap of all occurs when these symptoms appear and then completely vanish within a few minutes or hours. The overwhelming relief makes patients believe they are cured. This vanishing act is called a Transient Ischemic Attack, or TIA. The blood clot was there, but it cleared itself just in time. The danger, however, hasn't passed. Look at this chart. 10 to 15% of TIA patients will suffer a major permanent stroke within a 3-month window. Zooming in on the timeline, the immediate threat is clear. Half of these massive secondary strokes strike within the very first 48 hours. Feeling cured after your symptoms fade is a deadly illusion. A TIA represents the final, urgent warning shot before a catastrophic brain event. When confronted with these warning shots, people lean on their comforting everyday habits. The very first instinct is often to go to bed and try to sleep it off. That sleeping allows the brain damage to progress unnoticed in the dark. By the time you wake up, the strict time window for administering clot-busting medication has permanently closed. The instinct to take a warm bath to relax is equally hazardous. The sudden heat causes sharp fluctuations in blood pressure, which can trigger a lethal worsening of the stroke. Even having a simple glass of water is dangerous. Because a stroke frequently paralyzes the throat muscles, that water becomes a severe choking and pneumonia hazard. Our most common-sense remedies for feeling sick actively accelerate brain damage when the vascular system is compromised. This is why emergency medicine relies on the FAST protocol: face drooping, arm weakness, speech difficulty, time to call emergency services. It is an objective checklist designed to cut entirely through our natural rationalizations. The final psychological hurdle is often the fear of causing a fuss. People hesitate, worried about wasting the hospital's time over what might be a false alarm. Critical interventions, like TPA medication or catheter treatments, are strictly dictated by the clock. Hesitation guarantees permanent tissue loss. In neurosurgery, the directive is absolute. Call emergency services at the very first sign of a stroke. If it turns out to be nothing, you simply go home relieved. Overriding the instinct to wait and deliberately risking that false alarm is the single most important intellectual decision you can make to save your brain.